Fatty liver disease, also called hepatic steatosis, is a condition where excess fat builds up in the liver cells. Normally, the liver contains some fat, but when fat makes up more than 5 to 10% of the liver's weight, it is classified as fatty liver disease. Your liver is one of the most vital organs in your body. It's responsible for filtering toxins from your blood, producing essential proteins, and helps with metabolism. However, when fat builds up excessively, it can cause inflammation, damage, and potentially serious long-term health complications. The condition can be caused by many things such as poor diet, obesity, insulin resistance, and even alcohol consumption. In terms of prevalence, fatty liver disease is a silent but widespread health condition that affects nearly 1 in 4 people worldwide. That means 25% of all people are walking around with a liver that's quietly accumulating fat, often without any noticeable symptoms, until it's too late. Types of fatty liver disease. There are 2 primary types of fatty liver disease that doctors recognize. Number 1. Alcoholic fatty liver disease. This is the earliest stage of alcohol-related liver damage. When you drink, your liver prioritizes breaking down alcohol over its other jobs. But when you drink too much, it creates toxic byproducts that damage liver cells, leading to fat accumulation. If alcohol intake continues, it can lead to alcoholic hepatitis, cirrhosis, and even liver failure. The more alcohol consumed, the higher the risk of developing more severe liver damage. Number 2. Non-alcoholic fatty liver disease. This is the most common form and is a leading cause of liver disease worldwide, affecting over 100 million people in the US alone. This type is trickier because it's not about alcohol. It's linked to other issues like insulin resistance, obesity, and high cholesterol. It starts with simple fatty liver, where fat accumulates but typically causes no significant damage. It can progress to non-alcoholic steatohepatitis, NASH, which is a more aggressive form where inflammation and liver cell damage occur. In some cases, NASH can advance to fibrosis, where scar tissue begins to replace healthy liver tissue, and potentially to cirrhosis, which is a severe scarring condition that can lead to liver failure. Symptoms of fatty liver disease. The tricky thing about fatty liver disease is how it often sneaks up on people without obvious warning signs. Many people go years without realizing they have it, which is why it's sometimes called a silent disease. Let's walk through the symptoms as they typically progress, from early to advanced stages. In the early stages, you might experience what is called the subtle signals. These include feeling unusually tired even after a good night's sleep, and a vague discomfort or dull aching pain in your upper right abdomen, just below your rib cage. Some people describe it as a feeling of fullness or a slight heaviness in that area. You might also notice you just don't have the energy you used to have, getting winded more easily during regular activities. As the condition progresses, more noticeable symptoms typically emerge. You might experience unexpected weight loss, even without trying, which might sound good but actually signals your liver isn't processing nutrients properly. Your appetite might decrease, and you could feel nauseous more often than usual. Some people notice they get itchy skin, and there's no obvious reason like dry weather or allergies. When the disease becomes more advanced, the symptoms become more concerning. You might notice your skin and the whites of your eyes developing a yellowish tint that's called jaundice, and it's a clear signal your liver is struggling. Your belly might start to look swollen or bloated, which is called ascites, and your ankles and legs might puff up with fluid too. Some people find they bruise really easily or take longer to stop bleeding from minor cuts. Mental symptoms can also appear, particularly in advanced cases. You might feel confused more often, have trouble concentrating, or notice your memory isn't as sharp as it used to be. There are also some less common but important symptoms to watch for. Some people develop patches of dark skin, particularly in body folds like the neck or armpits. Others might notice small, spider-like blood vessels appearing on their skin, especially on the chest and face. Men might develop enlarged breast tissue, and women might experience irregular periods. The concerning thing is that by the time these more obvious symptoms show up, the liver damage might be quite significant. That's why it's crucial to pay attention to even mild symptoms, especially if you have risk factors for fatty liver disease. Causes of fatty liver disease. The causes of fatty liver disease are complex and often interconnected. For alcoholic fatty liver disease, the cause is straightforward: excessive alcohol consumption. Alcohol is processed by the liver, and when consumed in large quantities, it can overwhelm the organ's ability to metabolize it effectively, leading to fat buildup and inflammation. In the case of non-alcoholic fatty liver disease, multiple factors contribute to its development. Obesity plays a significant role, as excess body weight increases the likelihood of fat accumulation in the liver. When you eat more calories than your body can burn, especially from sugary or fatty foods, the liver stores the excess as fat. Over time, this fat buildup stresses the liver. Another main cause is insulin resistance, which is a condition where your body's cells don't respond properly to insulin. This often occurs in people with metabolic syndrome, type 2 diabetes, or those who are overweight. Genetics also play a crucial part. Some people are more predisposed to developing fatty liver disease due to their genetic makeup. High cholesterol, high triglyceride levels, and certain metabolic disorders can also increase the risk. Other than that, rapid weight loss, certain medications, and some medical conditions like polycystic ovary syndrome can also contribute to liver fat accumulation. Diagnosis of fatty liver disease. Doctors use several methods to diagnose fatty liver disease, often starting with blood tests. Liver function tests check for elevated liver enzymes like ALT and AST, which can indicate liver inflammation. However, blood tests alone cannot confirm fatty liver disease, so imaging tests are commonly used. An ultrasound is a common first step, as it can detect excess fat in the liver. In some cases, a CT scan or MRI may be needed to get a more detailed image of the liver and rule out other conditions. For a more accurate diagnosis, a doctor may recommend a fibroscan, which is a specialized ultrasound that measures liver stiffness, helping to detect fibrosis or scarring. In more severe cases, a liver biopsy may be necessary, where a small tissue sample is taken from the liver to examine under a microscope. This test helps determine whether simple fatty liver disease has progressed to NASH or cirrhosis. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for fatty liver disease. Treatment for fatty liver disease focuses on addressing underlying causes and preventing further damage. Here are the main treatments. Number 1. Weight loss. This is often the first and most crucial treatment strategy. Losing weight through a balanced diet and regular exercise can significantly reduce liver fat. Even a 7 to 10% weight loss can dramatically improve liver health. For example, losing 10 to 20 pounds if you weigh 200 pounds can significantly reduce liver inflammation. But slow and steady is better here, as losing weight too fast, more than 3 to 4 pounds per week, can stress the liver further. Number 2. Diet adjustments. A diet rich in fruits, vegetables, whole grains, and lean proteins, while limiting processed foods, saturated fats, and sugars is recommended. Avoiding saturated fats and going for healthier fats, such as those found in nuts, avocados, and olive oil, can also benefit liver health. Number 3. Avoiding alcohol. For AFLD, quitting alcohol is non-negotiable. Even small amounts can worsen liver damage. If you're struggling to cut back, talk to your doctor about support programs or medications that reduce alcohol cravings. Number 4. Medications. While there is no FDA-approved medication for NAFLD, certain drugs like vitamin E, pioglitazone, and GLP-1 receptor agonists have shown promise in reducing fat and inflammation in the liver. These should only be taken under medical supervision. Number 5. Regular exercise. Regular physical activity, aiming for at least 150 minutes of moderate intensity exercise per week, can significantly help reduce liver fat and improve overall metabolic health. Number 6. Liver transplant. In rare severe cases where cirrhosis leads to liver failure, a transplant might be the only option. This involves replacing the damaged liver with a healthy one from a donor, but it's reserved for severe, life-threatening cases. At the end, remember, in most cases, fatty liver can often be reversed with only lifestyle changes. By maintaining a healthy diet, Exercising regularly and managing underlying conditions, you can protect your liver and prevent complications. Now, we want to hear from you. Have you or someone you know been diagnosed with fatty liver disease? What lifestyle changes or treatments have helped the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.